This is a occipital bone. The foramen magnum lies horizontally and inferiorly and in the median plane. The squamous part lies posteriorly and it is convex. The basilar part lies anteriorly to the foramen magnum. The occipital bone is trapezoid in shape. Morphologically, it is irregular flat bone, and topographically, it is axial bone. Developmentally, it is membranocartilaginous bone. Why? Because upper part of the superior nuchal line develops from the membrane, and lower part of the superior nuchal line it develops from the cartilage. So now, what are the parts of the occipital bone? It has external surface, internal surface, and three angles: superior angle and two lateral angle, and four border: superolateral border and two inferolateral border. So at first I will discuss about the external surface. The external surface has external occipital protuberance, and this line we can see here, this line is called the external occipital crest. Here is the attachment, and this attachment is called the ligamentum nuchae, and one muscle is also attached here. It is called the trapezius muscle. And now three lines are very much prominent in here. This is the highest nuchal line, this is the superior nuchal line, and this is the inferior nuchal line. So some muscles are attached in these lines. So let's see. In the superior nuchal line, laterally from occipital belly of the occipitofrontalis, medially the epicranial aponeurosis. In the superior nuchal line, laterally the sternocleidomastoid muscle and splenius capitis muscle, and medially the trapezius muscle. Between the superior nuchal line and inferior nuchal line, laterally the obliquus capitis superior muscle, and medially the semispinalis capitis muscle. In the inferior gluteal line, laterally the rectus capitis posterior major, and medially the rectus capitis posterior minor muscle is attached. So now the condylar part. The condylar part has condylar proper and jugular process. The condylar proper in the inferior part here is articulates with the atlas, so it forms the atlanto-occipital joint, which is a condylar part of synovial joint. And here we can see a foramen. This is called the hypoglossal foramen. Here passes the hypoglossal nerve, emissary vein, and the meningeal branch of the pharyngeal artery. Now the superior surface. The superior surface here is present the jugular tubercle. Now the jugular foramen. The jugular process. The jugular process has jugular foramen. Here we can only see the notch, but it forms the foramen. So the structures passed through the jugular foramen are 9, 10 and 11 cranial nerve and some artery and vein. Here also a muscle is attached. It is called the rectus capitis posterior muscle. Rectus capitis lateralis muscle. The rectus capitis posterior muscle is attached in the basilar part. Now the Internal surface. The internal surface has internal occipital protuberance, and this is called the internal occipital crest. This is the sagittal sulcus, and this is the sagittal sinus, and the lip of the sagittal sinus is called here attached the falx cerebri. This is called the transverse sinus, and this is the Vermian fossa. Here is a inferior Vermian part is attached in here. This is the cerebral fossa, and this is the cerebellar fossa. In the cerebral fossa there is attached the occipital pole of the cerebral hemisphere, and here is attached the cerebellar hemisphere.